Hi, everyone. I'm Shawana Moore, Chair-elect of the NPWH Board.
And I'm Khalil De Mombrian. I'm new this year to the NPWH Board.
As a member of the Awards Task Force, we have the honor of presenting this year's NPWH Inspiration Awards.
Let me tell you, there have certainly been moments over the last year and a half where inspiration has been difficult to find. Reviewing the nominees for this year's awards was a much needed reminder of the incredible work happening in our field all around the country.
These awards recognize excellence in the women's health advanced practice nursing. And in the themes of this conference, our nominees have overcome challenges, led transformations, and are helping our profession to thrive.
Well, first up, our Practice Award. This award recognizes providers who demonstrate innovation and excellence in the practice of women's and gender-related healthcare. This award is close to my heart because I was last year's recipient. To me, it was an incredible validation of my own hard work and drive to provide my patients with the best care I possibly could.
So this year, we received multiple nominations telling the story of the amazing providers out there. We were so moved by them that we couldn't just pick one. Congratulations to our two Inspiration and Practice awardees, Mary Frazee from Phoenix, Arizona, and Ricshonda Nicole Milburn from Leech City, Texas.
My name is Mary Frazee. I'm a women's health nurse practitioner and a registered diagnostic OBGYN sonographer. I'm flattered to be acknowledged by the nation's collective of women's health nurse practitioners with this award. As I come ever closer to the end of my long career, I'm gratified to be recognized for my contributions to nursing and to women's health care. But let me start from the beginning. My nursing career began when I was 5. It all started when my grandmother told me that I was going to be a great nurse one day, and then made sure that I stuck to that path. Well, one thing led to another, and I graduated from nursing school and started working in women's health. I worked my way through GYN and antepartum and labor and delivery. For 6 of those early years, I was an OB flight nurse, transporting ill and laboring pregnant women from the outskirts of our great desert state to the high-risk obstetric centers. This role permitted me many hours in the medical library, where I developed a real love of learning about women's healthcare. In 1998, I graduated a second time from Arizona State University as a nurse practitioner. I joined a physicians group in Phoenix and commenced the daily office gynecology schedule that we all know and love. A few years later, I returned to school to obtain my ultrasound credentials and then became board certified in OBGYN ultrasound. My ultrasound credentials are unique and are a tool I use every day in the care of women in the office. As much as I enjoy my office practice, I also enjoy teaching. I've relished teaching opportunities during these many years since graduation. I've lectured at conferences and at my alma mater for graduate students. I especially enjoy the one-on-one mentoring of nurse practitioner and midwife students in the office setting. Lighting a fire for learning in our nurse practitioner students in our next generation is uniquely rewarding. 5 years ago, I joined another well-established women's health nurse practitioner in an NP-only clinic. We have similar experience levels and our individual strengths complement one another. We practice in a nursing model with wellness at the center of all that we do. What a joy it is to advocate and care for women in such a meaningful way. I'd like to accept this award with a full and grateful heart. Thanks to NPWH and my colleagues for the recognition. It really does mean so much to me. Thank you.
Hello, I'm Ricshonda Milburn, and I would like to say thank you to the NPWH for this wonderful award. I am honored to be the recipient of this year's Inspiration Award in Practice. I've been practicing as a women's healthcare nurse practitioner for 6 years, but my entire nursing career has been in women's health. I currently work in the Department of OB-GYN as a women's health nurse practitioner in the Urogynecology Division at UTMB in Galveston. My practice has always been guided by my philosophy in nursing to care. I understood early on that caring is the foundational practice to providing healthcare to women across the lifespan. Practicing with the caring nature gives me the ability to listen, which is key to providing care to women. This award is validation that when you are consistent in who you are and what you stand for as a nurse and as a healthcare professional, it will gleam in your practice. Making a difference in the lives of women each and every day is a pleasure that I have. I want to say thank you to my family and also my colleagues who support me every single day in what I enjoy doing. Thank you again for this award.
Next, our Inspiration and Education Award. Now, I'm not sure how many of you know this, but according to our last membership survey, over 30% of our memberships hold some kind of teaching position.
I think it says a lot about our profession's dedication to the rising generation of providers. We are invested in the future of the women's health nurse practitioner profession, and it shows. Our Education Award recognizes a women's health nurse practitioner who has made significant contributions to women's health education in a variety of settings.
It is our pleasure to present this year's Education Award to Ginny Moore from Nashville, Tennessee.
Hello, my name is Ginny Moore, and I am speaking to you as the grateful recipient of this year's Inspiration in Education Award. This past summer, I celebrated my 27th year as a board-certified women's health nurse practitioner. My North Star, my overarching goal in every professional decision and action over those years has been how to improve health outcomes for the women we serve. There is no better way to accomplish that goal than in educating our next generation of women's health nurse practitioners. In my role as the academic director of the Women's Health NP specialty at Vanderbilt University, I am privileged to work with diverse groups of students from all across the nation. I firmly believe that the more effective I am in my role as an educator, the better prepared my students will be and the stronger they will be in their roles as providers, which in turn will lead to improved health outcomes for women. This award is a validation of those beliefs. I am honored and humbled and grateful for this recognition. I am also appreciative of the opportunity to recognize the people who inspire me, from my colleagues at NPWH to my faculty colleagues at Vanderbilt, and to most especially all of my students, past, present, and future. You are my greatest inspiration. Thank you.
Finally, we have one last award to present, the Fran Legacy Award. For anyone who hasn't met Fran, she is an absolute force for women's health. She played a critical role in the founding of this organization, served on our board, and helped establish our education program.
Her advocacy for the WHNP profession and commitment to our work is second to none, and this award honors her legacy and those who are following in her footsteps. This year's recipient of the Fran Legacy Award is Susan Rawlins.
Like Fran, Susan is a trailblazer. She, with a group of passionate nurse practitioner colleagues, helped open one of the first teen-focused contraceptive clinics in Texas. She was the director of the nurse practitioner program at the University of Texas Southwestern Medical Center, which has prepared over 1,000 women's health nurse practitioners. She was on the Women's Health Nurse Practitioner National Exam Content Team at NCC for over 10 years. She has also served as a staff consultant to NPWH and has been absolutely vital to bringing all of us many of the CE options that we've utilized over the years. Thank you, Susan, for your incredible work. This award is well deserved.
Hello, everybody. I'm Susan Rawlins. I'm a women's health nurse practitioner, and I'm from Texas. I'm fully retired now, so I live in a small town in North Texas called Pottsboro. It's a joy to be in a small town after practicing in Dallas for so many years. Well, I've known Fran for a long time because she was part of the Title X program that I was a part of. She worked in Title X. I met her in Washington at different meetings, and she really was a driving force for making sure that women's health specialists were included in all the things that nurse practitioners were allowed to do. When I was in the nurse practitioner program in Dallas, I was the director of the continuing education component of that also. So I had spent years developing continuing education programs. So when I started looking at what NPWH was doing, it was so mirrored what we were doing in a local way that I really wanted to work with Fran for the larger program, because NPWH was my organization. It was my way to give back to the organization that made sure women's health NPs were in the public arena and in the regulators' thoughts and minds throughout the development of the role. Actually, if I look at me as a women's health NP, I think what I'm most proud of is probably the educator role, because all the years as a women's health NP, I saw lots of patients individually, and I feel like I did make a difference in their lives and the lives of their family. But when I became an educator and educated women's health NPs and prepared them for practice, throughout the next 20 years, I'd meet them at meetings and they'd tell me the joy of their practice and how many women they were impacting. And it really made me just feel good that from my small influence, I got to help other people go out and do what I did. And I think that's pretty universal for educators, but when you see people come back 20 years later that say, oh, I remember that lecture you gave, or that really made me feel like I could do this, it really makes you feel good. So there are lots of things that NPWH has focused on that I feel very honored to be a part of. To start her hub and to begin to develop information that's patient-oriented, but from a nurse practitioner viewpoint, I think is really an unmet need out there, that we focus on women and helping them be the most healthy women they can be, and that her hub was really vital to that. I think the other thing that NPWH did that I was really proud of was the Boulder Women's Health Movement. So trying to form this coalition of organizations who focus on older women's health. Older women in general are kind of marginalized, and their health is not as focused as it could be from general practitioners. And drawing together all the different organizations that help older Americans and focus on older women, since there are so many more older women than older men, I think was a good role for NPWH. I'm proud to have been a part of its beginning. And I guess the third thing that really I'm proud of is working with Beth and starting the Women's Health Review course. We created the first course that was created by Women's Health NPs. The lectures were done. We've all taken the Women's Health NP exam. And I think it really is focused on the skills that women's health NPs need to have in order to practice safely. I was really honored when Amy called and asked if she could nominate me for the award. So I thought that was an honor just to be nominated for the Franway Award. And to be selected for the award was really special to me. Having worked with Fran in the past, she is such a strong individual and such a guiding light for women's health NPs that to be associated with her in the award is just really an honor for me. I'm really lucky that I got to work with Fran at NPWH, and I have firsthand knowledge for how she helped the organization from the time of its inception till she finally said, I'm almost 70. I'm not going to be doing this anymore. Y'all young people need to take over. And that's how I feel. I can't believe I'm almost 70, but I'm really, really proud to see the young women's health NPs coming up, and they're doing such a good job. And it's just been a pleasure for me to see the transition. I hope Fran feels like I did my part for my years there. And I'm really enjoying watching the new NPs come up and and take their share and moving on toward the future.
That concludes our 2021 awards. Thank you to everyone who sent in nominations, and thank you to all of our members doing inspiring work all over the country.
Congratulations to all of our award winners today for your exceptional contribution to the health of women and gender-related practice. Thank you.